All right, good afternoon, everybody. Back with Josh and Paul, and David and Deirdre are here as well. Just wanted to, give you a quick update on where we are on COVID, then talk about some of our reopening strategy when it comes to outdoor events and cycles. First of all, the summary is the trends are all continuing in the same right path. 360,000 tests performed. That's close to 10% of our total population. Worth remembering, many people have been tested twice, so we're really a little under 10% in terms of our totals. Deaths are at single digits, tragically, but way down from where we were before, and hospitalizations continues down. I think this next chart will show you a little bit about hospitalizations, Max. What you see there is two things. You see the red line shows you where our peak was. Our peak in terms of hospitalizations, about 2,000, was on April 22nd. We're down about 90% in terms of hospitalizations since then. The yellow line you see on May 20th is interesting. That's when we did our phase of reopening for outdoor dining and stores and the such. And the good news there is I don't think we opened too early, and the trend lines in terms of hospitalizations have continued down. And that allows us to do our next phase of reopening tomorrow. This next map is fascinating. It's put together by the COVID exit strategy group. And what you see is in red are those states that are, quote, trending poorly. Trending poorly is reflected in terms of increasing hospitalizations, increasing positivity, percentage of those who tested and tested positive. Sadly, it's a reminder that the number of states here who are trending poorly is up compared to 1 week, 3 weeks, and 5 weeks ago. Mainly a lot of states, we talked about Arizona the other day, Texas, Florida, California is really in and around LA. These are the hot spots that we focus on like a laser beam, doing everything we can to make sure that doesn't happen here. Making progress, I think you can understand what those are about, but trending better is what I really wanted you to be able to see. That's, again, it's Connecticut, thankfully, as well as New York and New Jersey, over there, Illinois, and that means our positivity stays below at about 2%, which is extraordinarily good. Even a little less, the positivity rate in New York, which is extraordinarily good. And it's good news for us. That's one reason we can feel more confident about opening up restaurants and the such. Even though some people from New York may be coming up, they don't have a high infection rate. They have a low infection rate now going forward. So, testing, we're still in the top 10 overall per capita in terms of testing. A way to go, but I think that's another reason we're in the green, one of the positive states trending in the right direction. And of course, our hospitalizations continue down as well. And finally, this next chart, it's a little complicated, but it's the rate of transmission. And what that says is if you're infected, how many people are you likely to infect? And that means that if you're below 1, obviously the footprint for COVID is shrinking because for every person infected, you're not infecting another person. If you're on the red side of that graph, that's not a place that you want to be. New York and New Jersey, if anybody has, this is an eye test, by the way, New York, New Jersey, and Connecticut, that blue arrow, you can see have the lowest transmission rates in the country. And we were just thinking about what does that mean? Maybe it's because we got hit with COVID earlier. But then we looked over, we saw Washington State, WA is there in the red, for example. You know, that was hit even before us. I'm not going to overanalyze this, but I am going to tell you these are the type of metrics that we think about very carefully when we talk about reopening, how fast we can reopen. And the fact that New York, New Jersey, and Connecticut are more likely to be wearing the masks than some other parts of the country is making a big difference. Finally, I just wanted to talk to you a little bit about reopening starting tomorrow again. I think you know, and David has given you a good detail in terms of what we're doing in terms of indoor dining, since outdoor dining has worked pretty successfully over the last 4 weeks. hotels. I said before, we feel more confident, even people from out of state coming in now, certainly from our region, which has a low positivity rate, low infection rate. The personal services, we've done the hair, now we're doing the nails, now we're doing tattoos. David, you'll be happy about that. So we're getting some progress here in terms of a lot of what we're doing to get 95% of our economy up and operating. Outdoor, people ask me about a lot. And what are your protocols there? Why do we have rules about outdoor? I see thousands of people protesting, and yet I can't have a graduation, or I can't have a big outdoor barbecue in my backyard. What's going on, and what's your rationale? So starting tomorrow, first of all, for our personal space, our private gatherings, you can have up to 25 people indoors and up to 100 outdoors. Let me tell you what our thinking was there. That's up from 10 indoors and 25 outdoors under current structure. First of all, when it comes to these social gatherings, you're more likely to be interfacing with people closer, maybe drinking, less likely to have a mask. That's on the negative side. On the positive, they tend to be invitation only, or you know everybody who's going to be there. So if there was a flare-up, if somebody was found to be infected, track and trace is a lot easier to manage. So we thought this was an appropriate place for our inside private gatherings to be and our outside private gatherings. So that's a big change. Maybe New Jersey is a little more ambitious on that front. You know, Massachusetts and New York, Rhode Island, sort of comparable to where we are in that space. July 3rd, we're going to add on a few other metrics. As you know, for graduations, we're keeping that at 150. That's probably July 6th. I don't think he'll be doing that July 3rd. And Deidre and David have been working on this. Of course, it depends on your cohort. So if you have a group of 150 over here, and you have a group of 150 in another part of the football field, you have some room there to maneuver. But that's what it is for outdoor graduations. We're also thinking about big organized outdoor events. We have something called July 4th coming up, and the fireworks. And believe me, we've had good, vigorous discussions about what is a safe way to deal with the way that we celebrate our nation's independence and do it in a way that doesn't promote the infections. And we're learning from what we've done at the beaches and the parks, limiting parking a little bit, but more importantly, keep your social group 15 feet from other people. That's the way it's working on the beaches. Put your blanket down, watch the fireworks, stay with the group that you've been you know, hanging out with for a while. You know they're safe, they're like your family, and keep space 15 feet amongst those around you. I think that's a way that we can maintain our social distance and be able to enjoy the fireworks in a real way. And we're going to work with the organizers in terms of capping the overall group at, say, 500. So we just don't have a big mass gathering there because we're not sure who, if it comes to track and trace, we might have a better idea of who you were in contact with. That's what we're doing for the outdoor organized gatherings. Then we have event venues, amphitheaters, racetracks, and the such. And they're opening as well at 25% capacity, just like we're doing at museums and other facilities. And finally, we had a discussion, frankly, about what should we project about going forward a month or two from now. And you see how the world has changed in the last month. You can make a case, why do we project anything at all? It maybe leads to a false confidence, or you could have a flare-up like you've seen in a lot of those red states. Why do we want to give people an idea of what it looks like? Well, so you can plan, so you can have some idea of how we're thinking about events going forward, so you can plan accordingly, be wary, because if the metrics change, if hospitalizations scoot up, if we have these flare-ups, we'll have to, you know, change course. That's just reality. But so what we are thinking about is, you know, going forward in mid-July, we'd have bigger outdoor gatherings, say 250. And again, following the same social distancing protocols. And that gives you some indication about private gatherings as well, like a wedding and the such. So those are things that you can plan accordingly, knowing that there's a fair amount of risk. You know, sadly, my daughter Emily postponed her wedding just because she had too many friends that said, look, there's a good chance you're going to have this wedding, and I'm really positive about what's going on in places like Connecticut, but there's also a good chance it may not, and we've got to make a deposit on the plane and the such. So we're holding off. But I wanted you to get the best idea of how we're thinking about these outside gatherings and what type of progress we're making together, assuming the metrics keep going and we maintain our social distancing. With that, Deidre and David, you can add something, or maybe we just take some questions from people. I think it's questions.
Channel 3 Eyewitness News. Channel 3 Eyewitness News, unmute.
The question is about the DMV. Residents are asking us about priorities, waiting for the DMV to open so they can get their licensing. While the nail salons and amusement parks are opening up, is the DMV ready? Customers and agents are sharing the same space. Is the ventilation upgraded? Is the airflow improved? Those are the questions people are asking us.
Well, I can start on that, and then maybe David could help me out, or anybody. Weathersfield, Cheshire, we are opening those up by appointment only. We have a backlog of people who are waiting for their driver's tests. We're working with some private contractors to see if we might be able to answer some of that load, obviously wearing the mask accordingly. And finally, for DMV, as you know, we've delayed the time that you have to renew your license and other things that maybe we're going to take you into DMV, just so we could prevent against a rush to DMV, but they are opening.
Yeah, I'll just add that DMV is working on bringing additional services online next week, so starting to phase back in road tests. The knowledge tests have been continuing in a more limited fashion, but they're also working on some creative approaches for how we clear the substantial backlog of testing that has built up over the last 3 months. So the team's working hard on that. A lot of the services are online and are available now. If you have questions, go on the website, and you'll start to see even more services coming online next week with all the same protocols that we're implementing based on public health and occupational safety guidelines. You'll see a lot of plexiglass in there. You'll see a lot of markings on the floor with one-way traffic and spacing and all the things that I think people are getting used to at this point.
Thank you.
I'll add as well, this is one of the things that DMV, under the leadership of Commissioner Magyabani, is know before you go, and this is the perfect example during this time to know before you go. Go to the website, call ahead, have an understanding of what are the services you need to be done, but also know that other providers who are DMV partners, whether it's the Connecticut credit unions as well as AAA, are providing services as well.
Thank you.
NBC Connecticut.
Good afternoon, Governor. Last night, the Windsor Town Council approved a resolution declaring racism a public health crisis. I was just wondering your thoughts, if you'd had any discussions with Senator Anwar about his ask to have a state declaration. Well,
I'm happy to have that discussion. Not sure what a state declaration means if I can issue a lot of new executive orders, but I do know that this pandemic has revealed the racial disparities. And I think we knew this before, and it's really brought it home. The fact that if you're black, you're twice as likely to die, much more likely to die, much more likely to be infected, comorbidities. And this has just reminded us how we have to deal head on with the racial disparities as well as the healthcare crisis we have.
And with hotel workers in the state, they delivered to you a petition asking to strengthen health and safety guidelines for the hotel and lodging sector, including like mandating hazard pay for them. What are your thoughts on that?
Well, we work closely with the hotels as well as labor to make sure that workers felt safe going back to the hotels. We set very clear protocols in terms of what they have to do in terms of infection standards and the such. And like it is with all of our businesses, it's really important the hotels maintain those standards to give confidence to customers so they're willing to go back as well.
Do you have a number of the businesses that have self-certified? And if they don't self-certify and open back up, what the consequence of that is?
David?
Sure, I'm happy to take that. Yeah, so to date, over 15,000 businesses have self-certified. We estimate between 30 and 40,000 businesses shut down during the pandemic. So we'd expect to see more as we enter phase 2. What we saw in phase 1 is not all businesses are going to open on the 17th tomorrow. So we expect it to happen over the coming weeks.
And then my last question, there is a West Hartford salon asking customers to sign a waiver, basically that they won't get sued if the customer gets COVID-19. Are there any protections for businesses that you're considering enacting? I believe the Reopen Connecticut Committee had made a similar suggestion much earlier on.
I don't think so. We've set very clear protocols in terms of how a nail salon, hair salon, restaurant have to meet those protocols. I think that provides them a certain amount of protection, but just a certain amount. We've been careful on that. I noticed to go to a Donald Trump rally, you have to sign a waiver as well. So people are trying to avoid the risk, but I think most importantly, because David came up with a clear set of protocols, if any employee, any customer feels uncomfortable, doesn't think they're being followed, there's a 211 hotline. You can go report it. We'll be able to respond immediately as well. I think those are the protections you need.
News 8.
Hi, Governor. Stephanie Simoni here. I had a question about the fact that the state is hiring an outside firm to investigate nursing homes and how the Department of Public Health responded to this pandemic. What kind of violations could facilities see if they are in violation? Could staff be punished if they didn't follow proper protocol?
Well, I'll start on that, but and we just did an event about the nursing homes with the Bipartisan Women's Caucus from the legislature, very helpful. And you're right, we were early on in the nursing homes, as you know, in terms of stopping visitations, inspecting all of them. Now we've got a third party that's going to specialize in this, respond to our request, go to each and every one of these nursing homes, want to see why there was such a differential. Some had 0 infections, some had very, very, very high infection rates and fatalities. What were the moving metrics there? We want to make sure that we get it right if there is a second surge going forward. We want to think long-term about our nursing homes. Are there penalties and consequences? Absolutely. Some of these nursing homes have been fined already, and they operate under regulation of a Department of Public Health, so we'll be watching this carefully.
That was it. We haven't stopped since. Also, when could we see results of the investigation? How quickly?
Do you know that, Josh?
Yeah, the plan is to receive interim recommendations and feedback by mid-August with a target of a final report by the end of September.
Thank you.
If everyone could please mute your devices if you're not asking a question. Please mute your devices if you are not asking a question. Thank you. Moving on next to Fox 61.
Good afternoon. This question is for Commissioner Lehman about social clubs. We've had a couple of viewers write in about where they fall, obviously in phase 2, but are wondering if social clubs also host weddings. Are they allowed to follow the recommendations and the guidelines of, social distancing, reduced capacity, and holding weddings at those different venues?
Thank you for the question. So the short answer is for weddings, that type of gathering is going to have unique guidelines to it, and we are expanding and increasing the capacity there. But for that type of event, that's going to have a specific capacity restriction, which is separate from, for example, the restaurant or the pool guidelines that we have out for social clubs. Just as the governor mentioned at the outset, the nature of that event and the commingling and what we view as the risk of transmission at that event is different. So for social clubs that are doing their normal course business, they'll follow restaurant guidelines again and pool guidelines. But for specific outdoor events, they will need to be subject to those caps and the outdoor event guidance that we provided.
And that would be the same for social clubs who act primarily as bars?
So social clubs, again, if it's primarily a bar, or if it is a bar, that's not able to be open until phase 3. Offering a dining experience and food with the alcohol has been something that we've felt strongly about as we've opened up these types of institutions. So for social clubs that fit that bill, they should be able to open in phase 3 if it's a bar, but phase 2 if it effectively serves as a broad social club with other activities as well.
And Governor, a quick question for you too. We have so many people that are flocking to Connecticut's beaches now that the weather is nice and warm. Do you know when the bathrooms will be open at the beaches? We're getting a lot of questions about restrooms.
Now, aren't they? Aren't we opening those up now? Let me get back to you on that. I think it's overdue.
Thank you.
News 12 Connecticut. News 12. WTIC 1080 News. Connecticut Public Media. The Waterbury Republican American.
Thank you, Max. Governor, I was wondering if you and your team there could share what businesses or aspects of this latest reopening phase give you the cause for most concern. Where are you worried? What might worry? Why don't we just stick with that?
Well, early on, I can tell you I was worried about indoor dining. Your mask is off. You're in fairly close quarters. You're indoors, which is riskier than outdoors. I worried about folks coming in from out of state where perhaps their dining wasn't open. A lot less worried about that now for the reasons that we learned from outdoor dining, given the fact that the infection rate of our neighbors is much less. I had worried about the hotels and attracting a lot of people from out of state and that back and forth. But again, given the reasonably consistent low infection rate throughout our whole region, I feel pretty confident on those two. Those are the two I thought most about going back a few weeks.
Governor, if I could just add one comment here. One of the things I think is really important in terms of what if anything keeps me up at night, it's broadly the culture of compliance that I think we need to keep making sure that we have here in Connecticut. I think it's one of the reasons that we've done so well and our metrics are so strong to date. But as we enter in phase 2, make no mistake about it, we need to keep doing all the mitigation measures that are out there. So specifically, mask wearing is critically important. We need to keep doing that as we reopen the economy. Otherwise, we're going to jeopardize our reopen. Hand hygiene, whether it's sanitizer or hand washing, is critically important. And then lastly, physically distancing. So my concern is that people see the data and they think that we're back to normal, but we're not. It's important that we reopen the economy, but we can't let our guard down as it relates to these mitigation measures. Otherwise, we will jeopardize our reopening, and we don't want to go back to where we were in March and April. So we need to make sure that we do that across all the businesses that are opening here tomorrow.
And I guess in follow-up on an earlier question, we've got a reader question asking us when are picnic tables going to be back at state parks?
I hear a deafening silence, so Katie Dykes will get right back to you on that.
Okay. Then could I ask you to respond to a lawsuit that was recently filed by a group of 5 small business owners and State Senator Rob Sampson that basically challenges the constitutionality of your powers to designate businesses as essential or non-essential for the purposes of remaining open to the public during a public health emergency?
Whew. Well, I didn't know about another lawsuit, but look, the legislature, on a really strong bipartisan basis, gave me some executive powers given the fact that COVID was crashing on us like a wave. And we had to move quickly, we had to move expeditiously. We worked, our team worked, Paul in particular, briefing the legislators, at least the legislative leadership, on a regular basis going forward. We tried to limit what we did in terms of health care, COVID health, our COVID health response, what we did in terms of, businesses opening and closing. By the way, I should remind you, almost all of them had closed before we had to close the last ones. Everything we did with an eye on limiting the spread of COVID. These executive powers that the legislative granted me will be done in about September, I think, and legislature's coming in, so I'll have a chance to talk to them again.
And we just have another reader question. You had this one before. When do you expect state offices to sort of reopen to the public for more in-person business or remote?
Want that?
Sure. So we're following with our state operations the same protocols we put out for private businesses, which starts with if you're able to work from home, that's still the preferred option. We'd like to keep the risk as low as possible through telecommuting, and we've enabled a substantial amount of telecommuting over the last several months. Where there are citizen or resident-facing services that have been discontinued, each of our agencies is working through a reopen plan on how to do that. There's a lot of online services that are all available. They're all communicating via their respective websites. And we will see more people coming into the office slowly, but again, we want to keep that only to really activities that are required to be done in person and try to, again, keep the physical distancing, telecommuting as much as possible.
Okay, thank you very much.
The Hartford Courant.
Hey, this is Emily Brindley from the Hartford Courant. Governor, given the rising numbers of cases in other states, as you talked about a few minutes ago, do you have any concerns about out-of-state travel, either people coming in from other states or Connecticut residents going somewhere else and then returning?
I think we watch this carefully. If you're feeling ill, you're symptomatic, you're coming in from out of state, or you're returning home, obviously you stay home and you self-quarantine. I think that's really important. Some of the governors are telling people to automatically self-quarantine. I don't think we're there at this point. But I do look at some of these other states right now. Some of them are hot zones. Some of them have a 20% infection rate. So we are going to pay special attention to it, but not yet in terms of any mandatory changes.
And then in terms of just kind of in general protecting the state's COVID progress, what other resident behaviors are you keeping an eye on? Like what are the potential triggers that you're worried about that could kind of roll back the state's progress on this?
I think our reopening strategy has been cautious and appropriate. What do I worry about? I worry about, thousands of people at protests, or people getting casual on the beach and not wearing their mask, or hundreds of seniors at a gambling casino and they're having a Coca-Cola and they're not wearing their mask. I worry about some potential hot spots there. I worry about the congested neighborhoods, those that are more densely packed, where Josh is making such an extra effort to make sure people get tested. I think broadly speaking, we're doing very well in terms of community spread and holding down. What I worry about as I look around other states is the possibility of these flare-ups. If you don't control that with track and trace, they can spread quickly.
Thank you.
Hearst, Connecticut Media.
Hi, Governor. It's Caitlin Krasholtz. Can you hear me?
Sort of.
Yes.
Okay. Hi. I have a couple of questions for you. The first is regarding the masks. As the data continues to improve, at least comparative to the peak and compared to other states, and as the state reopens, we've seen kind of anecdotally that people maybe are getting lax about that. I know that you launched a marketing campaign to encourage mask wearing, but are you considering increasing any sort of enforcement? I know there's a no mask day planned for this weekend. So will you be stepping up enforcement regarding mask wearing?
No, I don't think so. What I've noticed, especially talking to my fellow governors, is Connecticut's been pretty good about wearing the mask. They're using their judgment. If you're in a park, you're not near somebody, that's different. If you're inside, you're in a store, you have to wear it. That's what the rules are. And if we find people are getting more and more lax, as we've seen in some other states, we'll take a second look. So far, so good.
Great. And the Police Chiefs Association placed a 90-day moratorium on purchasing surplus military equipment. Do you have a response to that? 90 days, isn't that long. What happens in 91 days?
I think that is sort of my response. You know, here at the state level with the state police, we have an indefinite pause. And the legislature, when they get back together, they're going to be coming up with some rules of the road that will impact the local and municipal police. I don't think they need this military-style equipment, so I hope their pause is a lot longer than 90 days.
The Connecticut Mirror.
Thanks, Max. Governor, I wanted to ask you about the prospect of a special session. I know you've said that you're open to talking, having it deal with issues of police accountability and absentee ballots, but I'm curious if you're concerned about if the agenda expands too much, because you have a large pandemic-induced budget deficit to deal with after July 1st. And I'm curious, quite frankly, if you think that it has the potential to get even worse if we start launching programs that we probably can't afford.
Well, Paul Mounds is leading the discussion with the legislative leadership, Republicans and Democrats alike. I think there's a general consensus about what we want to accomplish in a shortened session in the middle of, COVID. With two things we really have to work towards. One, police accountability. We've discussed that a fair amount in terms of what we'd like to accomplish with a special session. We haven't spent quite as much time talking about making it easier to vote, absentee ballots, voting by mail. Again, a COVID-related event because we don't want seniors waiting in long lines to vote. We saw what happened in Georgia. So I think that's what Paul is focused on with legislative leadership. I think that should be the focus of a very short special session. We'll have plenty of time to think about bigger issues with more public hearings that deserve the attention later on this year.
Would you agree, Governor, that you can probably do police accountability and absentee ballots, though, without a sizable fiscal impact? And I guess I'm asking if there are any other proposals that do have a significant fiscal impact. For your mind, do those have to wait until the 2021 session?
I think that's right, Keith. Nothing that I have seen is fooling around with the budget. You know, as you know better than anybody else, we're right up close to a spending cap. But I think what we've got on the plate right now in terms of accountability and voting will not have a fiscal impact, and we can get that done soon.
Thank you.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, in light of the pandemic, there's been sort of a renewed interest among some families to resurrect legislation that would allow nursing home residents and their families to have cameras, electronic monitoring devices inside the rooms of the residents. I wondered how you thought about that, and perhaps the commissioner could weigh in as well.
Yeah, I know Deidre issued some guidelines in terms of how we can start being able to get back in personal contact with our loved ones. It's really important, and they've been socially isolated for a long time, doing some things outdoors, doing some things in terms of testing with a fever, in terms of making it appropriate. I was talking to Vanessa Durantes from Department of Children and Families, and they're doing a lot with FaceTime. And, they used to have to do visits every day to visit, folks who are in foster care. And they're finding with the FaceTime, they're able to be very effective, cover a lot of space. But I don't think that covers for a loved one at a nursing home. Deidre?
Yes, thank you for that question. We certainly understand the frustration that families are feeling when they're not able to visit their loved ones in nursing facilities. And we have been, as the governor alluded to, working with the industry very closely on implementing, for example, the ability to have outdoor visits, socially distanced outdoor visits with loved ones, and making sure that that option is being offered consistently to families. And as the governor mentioned, the type of electronic visits. And CDC and CMS have issued some guidance around beginning to reopen nursing facilities to visitation. Obviously, we want to be very, very careful, as this was the segment of our healthcare industry that was obviously the most hard hit by COVID. We want to be very, very careful while acknowledging and respecting the understandable need for families and loved ones to see one another again. We are implementing a testing strategy in our nursing facilities, so we'll be able to know when a facility has been COVID-free for a period of time, and that will certainly help us with some safety measures. So we're taking it slowly while also balancing the needs of families and residents in the nursing homes.
Thank you for that. But this legislation is really more about having electronic monitoring in there. They are concerned. It's not just FaceTime. They want to be able to have access to see what's going on in those rooms 24/7.
Yeah, that's a complicated question. There are obviously, some potential upsides to that and also some potential downsides in terms of privacy, et cetera. I know other states have looked at this, and it's been a question that's been grappled with. So it's a complicated issue that, merits a lot of discussion before we would put something like that into place.
And on another subject, Governor, I'm a loyal user of the How We Feel app, and I've noticed there's been a drop-off some days in the participation, and I know that your administration had hoped to use technology to keep track of the pandemic and try to watch out for hot spots. I wondered, is COVID fatigue something you're concerned about, and you won't be able to rely on that information from the app or any other of these types of technologies to keep track of where COVID stands?
Yes, so that's a really good question. You're right. We ramped up to something like 75,000 users on How We Feel. It gave us a little bit of a crystal ball, what's going on in Eastern Connecticut versus Northwest. And we could see some differences there. And some, as you point out, usage is slipping a little bit. But I hope it doesn't mean people aren't paying attention to COVID, because it's really important that we maintain our, protect our guard, keep up our guard.
But there are other ways that we're monitoring? I'm sorry, Commissioner, to interrupt.
Governor, could I add something there? So what I'd like to your question about is are there other things we can do? And the answer to that is the things that Commissioner Lehman emphasized, which is not let down our guard on the mask wearing and the social distancing. It's hard to overemphasize that. To protect our economy as well as protect our health, we need to keep up with the mask wearing, even when we're going to these outside events. And wear the mask when you're leaving and entering, and then if you're seated for a while far away from everyone, you can take it off. But in addition to that, I really want to impress on everyone the importance of getting tested if you have any symptoms at all of COVID-19. The beginning of this pandemic, when across the country testing was not easily available, there was an emphasis on testing those who were on the sicker end of the spectrum. We're not in that position now. And so to your point about early signals, everyone who has a symptom of COVID, whether that's a sore throat, a cough, a loss of taste or smell, even nausea or vomiting, shortness of breath, and in particular, if you have an underlying health condition like hypertension or diabetes, if everyone who has a symptom of COVID gets tested early on at the first sign, that will really help us understand if we're starting to see an uptick in cases. And testing is widely available for everyone who has any symptom at all. So I would encourage the public to take advantage of that.
Thank you very much.
You're welcome.
The Day of New London.
Hi, good afternoon. Here in New London, we have a number of ferries, and I wondered if you could address what safety protocols and restrictions are in place for ferries, particularly as more people start taking them, such as any restrictions on percentage of capacity, social distancing, mask wearing, and concession stands.
I'm happy to take this one, Governor, if you'd like. Yeah, so for ferries broadly, there are restrictions, and it's similar to what we're doing for other businesses. So there is reduced capacity. There is a requirement to ensure that there's spacing, whether it's standing by rail length or by seating. There is frequent cleaning of common touch points. And I believe we are asking, I don't need to confirm this, but if there are amenities like a snack bar, that those amenities are closed. But I'll confirm that last point. But it's similar to what we're asking for other like businesses. Again, mask wearing, cleaning, reduced capacity, and making sure that people really embrace all of that as they use the ferry.
Thank you. And sorry, could I ask what the reduced capacity is?
I believe it's 50% for ferries. Again, but there's typically a limitation to ensure that there is adequate distancing by a rail length as well, but 50% is the guideline that we're providing.
Thank you.
CT News Junkie.
Thanks, Max. My first question is for Commissioner Gifford. I wanted to know, the nursing homes say that they have been reporting recovery data, and this information has been reported to the state. Is there any ability to share that publicly, or is this information that will be reported in the future?
You're asking about the number of individuals who had COVID and have since recovered?
Correct.
Yeah. It can be a little tricky to calculate that, but we are certainly looking at continuing to evolve and expand our nursing home reporting. And because as we've begun to do the broad testing of both residents and staff, we want to make sure that we are both aligning with the national requirements for reporting and making sure that we're giving consistent information about any changes in status. So we'll get back to you in terms of whether there would be a public report on specifically number of individuals who have recovered, but you're likely to see our nursing home reporting evolve over the next weeks or so as we switch from the intensity of the pandemic to a more steady state in nursing homes.
Okay. And Governor, I have a question about early in March, you granted nursing homes and hospitals immunity, from malpractice lawsuits related to COVID. Is there a chance that you might do another executive order to shorten or give them back the ability to sue these providers before the September? Before your orders are up in September?
Yeah, Christine, I think that's something we think about. I mean, remember, gross negligence, you're still liable. You can be fined. We regulate you in terms of your licensing if you can stay in. So there's still plenty of sanctions if you're not getting the job done in a totally appropriate way. We did provide some liability protection early on just because we had a lot of COVID patients. We're moving them around. It was new. We're trying to get the nursing homes to make sure they could have COVID-only facilities. We're in a different environment now, so we'll take a look at that.
Thank you.
Bosecto Media.
All right, I'm getting the signal. One more thought on George Floyd. We've talked about this a fair amount, but something, our administration has tried to do from the very beginning is make sure we have a team that reflects the amazing diversity of our state. And I think that's more important now than ever when it comes to law enforcement. And what I wanted to do is give you an idea of why we've been able to double the number of people who are not white males who are now coming to serve in our state police. If I can do this in our municipal police, we can do that with judges, we can do that with teachers. What a better state we would be. And this is the recruit we've done that has attracted a lot of folks who might find being a state policeman is not a bad place to make a difference.
Policing in America is transforming. Technology, innovation, and hard lessons learned from history have changed how we serve our communities. As we embrace a new generation of policing, we seek the next generation of law enforcement officer. We seek those who will do what's right and stick to their values. We seek those eager to build trust and break down barriers. We seek those who are willing to encounter difficult situations and put the well-being of our strangers above their own. We seek those who are determined to make our state a safer place for our families. We are seeking you, the next generation of Connecticut State Trooper.
Every day we're trying to do a little bit better. Thank you, everybody.